Clopidogrel is one of the most widely prescribed antiplatelet medications in modern cardiovascular medicine. Millions of people around the world take this medication every day to reduce the risk of serious and potentially life-threatening blood clots. These clots can block important arteries in the body and lead to dangerous conditions such as heart attacks and strokes. In many cardiovascular diseases, the blood becomes more prone to forming clots inside arteries. When a clot forms in a coronary artery, it can block the supply of oxygen-rich blood to the heart muscle. This can cause a myocardial infarction, commonly known as a heart attack. Similarly, when a clot blocks blood flow in the brain, it can result in an ischemic stroke. To reduce these risks, doctors often prescribe medications that prevent platelets from clumping together and forming clots. Clopidogrel is one of the most effective medications used for this purpose. It works by interfering with platelet activation, which helps maintain normal blood circulation through the arteries. Clopidogrel is commonly prescribed to patients who have recently experienced a heart attack or ischemic stroke, or those who suffer from peripheral arterial disease. It is also frequently used in patients with coronary artery disease and in individuals who have undergone procedures such as coronary stent placement. Because of its powerful ability to prevent clot formation, Clopidogrel has become an essential part of treatment for many cardiovascular conditions. However, like all medications, it also comes with certain risks and precautions that patients should understand. In this video, we will explore 7 important effects of Clopidogrel, including how it works inside the body, its dosage recommendations, possible side effects, and important safety precautions. 1. Inhibits platelet aggregation. The most important effect of Clopidogrel is its ability to inhibit platelet aggregation. Platelets are tiny blood cells that play a crucial role in the clotting process. When a blood vessel is injured, platelets quickly gather at the site of injury and stick together to form a clot. This process helps stop bleeding and protects the body from excessive blood loss. However, in certain medical conditions, platelets can become overly active and start forming clots inside healthy blood vessels. When this happens inside arteries that supply the heart or brain, it can lead to serious complications. Clopidogrel works by reducing the ability of platelets to stick together. By preventing platelet aggregation, it significantly reduces the risk of clots forming inside arteries. This effect helps maintain proper blood flow and protects vital organs from damage caused by blocked blood vessels. Because of this mechanism, Clopidogrel is commonly used as a preventive treatment in patients who are at high risk of developing cardiovascular events. 2 blocks AP receptors on platelets. Clopidogrel belongs to a group of medications called phenylpyridines, which work by blocking specific receptors on the surface of platelets. One of the key substances involved in platelet activation is adenosine diphosphate, commonly referred to as AB. AB plays a major role in signaling platelets to become active and start forming clots. When AB binds to certain receptors on platelet surfaces, it triggers a chain of reactions that causes platelets to change shape and become sticky. Once activated, platelets begin attaching to each other and forming aggregates that eventually become blood clots. Clopidogrel works by selectively blocking these AP receptors. By preventing AP from binding to its receptors, the drug stops the activation process that normally leads to platelet aggregation. As a result, platelets remain less active and are much less likely to form clots inside blood vessels. 3. Produces long-lasting antiplatelet action. Another important feature of Clopidogrel is that its action on platelets is irreversible. When Clopidogrel blocks AP receptors on a platelet, that platelet remains inactive for the rest of its lifespan. Platelets typically survive in the bloodstream for about 7 to 10 days before they are replaced by new ones produced in the bone marrow. This means that the antiplatelet effect of Clopidogrel lasts for several days even after a single dose. Because of this long-lasting action, the medication provides continuous protection against clot formation. However, this also means that if bleeding occurs, the effects of the medication cannot be reversed immediately simply by stopping the drug. The body must produce new platelets to restore normal clotting ability. 4 works as a prodrug activated in the liver. Clopidogrel is classified as a prodrug, meaning that the medication itself is not fully active when it first enters the body. After the tablet is absorbed from the digestive system, it travels to the liver, where it undergoes metabolic transformation. In the liver, special enzymes convert clopidogrel into its active form. One of the most important enzymes involved in this process is part of the cytochrome P450 system, specifically the enzyme CYP to C19. This enzyme converts clopidogrel into its active metabolite, which then circulates in the bloodstream and blocks AP receptors on platelets. However, not everyone metabolizes clopidogrel in the same way. Some individuals have genetic variations that reduce the activity of the CYP to C19 enzyme. These individuals are sometimes referred to as poor metabolizers. In such cases, the body may produce less of the active form of clopidogrel, which may reduce the drug's effectiveness in preventing clot formation. 5 helps prevent heart attack and stroke. One of the most important clinical benefits of clopidogrel is its ability to reduce the risk of serious cardiovascular events. Patients who have already experienced a heart attack or stroke are at a higher risk of developing another one in the future. By preventing platelets from forming clots, clopidogrel helps lower this risk. Doctors commonly prescribe this medication to patients who have recently suffered a myocardial infarction, ischemic stroke, or peripheral arterial disease. Clopidogrel is also frequently used after procedures such as coronary angioplasty and stent placement. When a stent is inserted into an artery to keep it open, there is a risk that platelets may stick to the stent and form clots. By inhibiting platelet aggregation, clopidogrel helps prevent this complication and keeps the stent functioning properly. 6 increases the risk of bleeding. Because clopidogrel interferes with the normal clotting process, it can increase the risk of bleeding. Most patients tolerate the medication well, but some may experience easy bruising, nosebleeds, or prolonged bleeding from minor cuts. The risk of bleeding becomes even higher when clopidogrel is taken with other medications that affect blood clotting. Examples include anticoagulants such as warfarin, thrombin inhibitors, aspirin, and certain pain medications known as non-steroidal anti-inflammatory drugs. These medications may further reduce platelet activity or interfere with clot formation, which can increase the risk of internal bleeding. For this reason, patients should always inform their doctor about any other medications they are taking before starting clopidogrel therapy. 7 may cause side effects and rare blood disorders. Like most medications, clopidogrel may cause side effects in some individuals. Common side effects include headache, diarrhea, chest discomfort, joint pain, and symptoms similar to upper respiratory infections, such as a runny nose or flu-like illness. Some people may develop skin rashes or allergic reactions. In rare cases, an allergic reaction called angioedema may occur, which causes swelling of the lips, tongue, or throat and requires immediate medical attention. Very rarely, clopidogrel may cause serious blood disorders. These include neutropenia, which is a decrease in certain white blood cells, and thrombocytopenia, which is a reduction in platelet count. Another rare but serious condition associated with clopidogrel is thrombotic thrombocytopenic purpura, often abbreviated as TTP. This condition involves the formation of small clots throughout the bloodstream and requires urgent medical treatment. Clopidogrel is usually available in tablet form and commonly comes in 2 strengths, 75 mg and 300 mg. The 75 mg tablet is typically used as the daily maintenance dose. Patients usually take this dose once a day to maintain continuous protection against clot formation. In some situations, doctors may prescribe a loading dose of 300 mg. A loading dose allows the medication to begin working more quickly, which is especially important in emergencies such as acute coronary syndrome or unstable angina. After the loading dose, patients generally continue with a daily maintenance dose of 75 mg for several months or as directed by their physician. In elderly patients, especially those older than 75 years, doctors may avoid the loading dose because of the increased risk of bleeding. Patients should never stop taking clopidogrel suddenly without consulting their healthcare provider. Stopping the medication too early can increase the risk of a dangerous condition known as stent thrombosis, particularly in patients who have undergone coronary stent placement. Stent thrombosis occurs when a clot forms inside the stent, blocking blood flow to the heart. This can result in a severe and potentially fatal heart attack. If the medication must be temporarily discontinued for surgery or another medical reason, doctors usually recommend restarting it as soon as possible to maintain protection against clot formation. Clopidogrel is one of the most important medications used to prevent dangerous blood clots in patients with cardiovascular disease. By blocking AP receptors on platelets, it reduces platelet activation and prevents the formation of clots that could block vital arteries. This powerful antiplatelet effect helps reduce the risk of heart attacks, strokes, and complications related to coronary stents. However, because the medication interferes with the body's normal clotting process, it must be used carefully and under medical supervision. Patients taking clopidogrel should follow their doctor's instructions closely, be aware of possible side effects, and report any unusual bleeding or symptoms promptly. When used correctly, clopidogrel plays a critical role in protecting the heart and blood vessels and improving long-term cardiovascular health.